Mission accomplished. Well, I want to welcome everyone today. I appreciate your reading the emails so very closely and realizing that we're starting at 9 o'clock rather than 10 as usual. Uh, I guess we have a very intelligent, smart, alert group here, and we keep track of time. So thank you. I'm glad you all made it here. I think this is really going to be interesting, and this is something we've talked about before, and is of great interest to our group. So I'm just going to make a couple of very quick announcements before we get into the discussion. Um, uh, First, I want to wish those of you who are having a birthday today a very happy birthday. I won't embarrass anybody by saying exactly who it is, but you know who you are. So happy birthday to everyone. Um, Tentatively, our next meeting of our group will be June 16th, Monday, June 16th. We will do this in person. More information will be coming out later, but we'll meet in person and again talk about the things that are important to us, what we want to do in regard to that, and just get a chance to socialize a bit instead of little squares on a screen. Um, I will confirm exactly where and the date also. There's some conflicts with that date that have to be worked out. Um, if other people have other announcement that they want to make about things that are going on, there'll be time at the end of the meeting at after the discussion to make those announcements. If for some reason we run out of time, email me uh, the information about whatever activity or thing that's going on, and I'll make sure that it gets out to the group. Um, and then also after today's discussion, we're going to talk more about another important issue that's going on. It's the Medicaid cuts to the federal government, federal budget, and what we might want to do about that, and what's going on, and what actions we might want to take. So but with that, uh, let's get started on the discussion. Uh, Let me introduce the two people who will talk with us today. Uh, First, John Scanlon. He's a member of the county council, also a member of the health board because he is a member of the council, and also of the advisory board to the county health board. So he's very familiar with this, and he spent time interviewing other counties and what they've done on the issue of the composition of the health board. So very knowledgeable about this. Carol Frazee is also here with us today. She's a former council member and was interested in this issue and looked into this back when it was well, maybe first discussed. I think that's back in uh, 2022. Just a very quick background to this because they'll fill you in more about it. But there was a bill passed in the legislature in 2022 um, that established the composition of county health boards, in addition to doing some other things. Um, and the legislation required that county health board should consist of members from three different groups: public health officials, consumer representatives, and just other community stakeholders. This might be some nonprofit that works with a vulnerable group, like um, a group that is working with the homeless, something like that. But this legislation did not apply to Whatcom County and a few other counties because Whatcom County is a charter county, and the county board determines how the health board will be composed. So recently, this question has come up whether the county should change the composition of the health board. So with that, I'm going to let our speakers begin. Maybe John, if you can begin with your presentation and what you know about this question and the pros and cons of this, and then Carol, if a question comes up, if you can help if you want to add something to this, and then also add your thoughts and your concerns about this issue. So go ahead, John.
Hello, everyone. And I will out myself. I am one of the birthday folks. And I know of at least one other, Carol. So Carol and I are birthday twins. Um, and another elected official in our county, I think she doesn't mind saying it either. Sharon Shoemake also has her birthday today as well. Um, so I was born the day after St. Helens erupted. I was born on the East Coast in Portland, and I always remember, my parents talking about, seeing the news and reading the stories, as my mom was going into labor. And so it's something that has always drawn me to the West Coast. And I've had a chance to climb St. Helens up to the rim a few times. So it was one of those things that always drew me from someone who grew up on the East Coast to the move to the West Coast and to Washington State. Um, so happy birthday, Carol. Um, it's always fun having a twin on a day like today. Uh, so um, uh, I'll go and talk about some of the process of what we've been doing here on the Board of Health and working with the Public Health Advisory Board. And Joni Hensley is here. Joni is a member of the Public Health Advisory Board and has been doing a lot of work on this topic. Thank you, Joni. Hi, Joni. I'm going to see you later today. We have a work group meeting. And I see a lot of other good friends here, and I know folks who've been following this issue. Um, Public health and healthcare is was one of my main drivers for running for office. I come from a healthcare family. When I was young, my mom was a nurse when I was growing up. Her sister, my aunt, was a nurse. And then later on, I fell in love with a first year med student, and we got married, and my wife was a doctor. So I've been surrounded throughout my life with people who work in healthcare and work in public health. I did some work early in my career on global public health issues, HIV/AIDS, infectious diseases, pandemic disease. And one of the issues I worked on almost 18 years ago now or so was H5N1 avian flu, as that was spreading throughout Southeast Asia. I was working for a humanitarian aid organization that had offices there that was looking at it both from a programmatic response, what do we do for people, and then what do we do for staff, and how do we start to prepare? So, the conversations that we all had globally and locally around things like masks and PPE were conversations that I was part of for a global organization around 2005, six or so, preparing for H5N1. So these are issues I'm passionate about, I care about, and I know that many of you do as well. We know we have healthcare disparities and inequities in our county. So one of the other issues I know that you all have discussed and I've been working on and talking with some other folks here is the idea of a public hospital district for the county. That's an issue I'm still working on. And I see Cleveland just popped up on the screen. I've been talking to Cleveland about this with Jessica. Jessica is running for county council in District 3. I hope you all get to meet Jessica this year. So these are issues that I care about and I'm working on. This year, I also became chair of the County Board of Health. So under our current structure, the county council serves as the Board of Health, all 7 members of the county council. And traditionally, the chair of the council has been the chair of the Board of Health. And this year we decided to split that structure. So Councilmember Galloway, Katie Galloway, is chair of the county council. I'm vice chair of the county council. And we decided this year to split the structure. So I took on the role of chair of the Board of Health. So I started that in January. So last year, we started off a process of studying the Board of Health structure. This is an issue that I've been looking at for a number of years, even prior to running for office, following the county council and looking at other counties and what other counties have done with the change in the state law a few years ago. So if you don't mind, I have a few slides that I'll share that'll go through some of this process. Let me get this into the correct format. Okay. Oh, oops, I already skipped ahead. We started out with the process last year where we selected a handful of county council members and a handful of members of the Public Health Advisory Board to join a work group to study our Board of Health structure. I think I also see Leah here. Leah Wainman is a member of the Public Health Advisory Board, and also with Joni was part of the first work group we had for this. And I hope you don't mind if I'm saying Leah is also running for city council in Bellingham. So I hope people get to meet Leah this year as well with her run for office. Um, so we started this in October. We kicked off a structure of pulling this group together to study other counties, what has worked, what hasn't worked, and what lessons there might be for Whatcom County. Uh, so one of the things we did early on was I invited someone from the Washington State Association of Local Public Health Officials, Jamie Bodden, who works for that organization, to come to county council and give a presentation on what has been done in other counties and what lessons there are with what other counties have done by changing their Board of Health structure. So as was stated at the start of the meeting, there was a state law that passed in 2021 that allowed for changes in local health jurisdictions to expand their local Board of Health. And as was stated earlier, unless certain criteria were met. So Whatcom County, as a charter county, was allowed to keep its current structure, though we also had to expand the structure of the Public Health Advisory Board, which is an advisory body that advises the county council and the health department on public health matters. So by expanding the Public Health Advisory Board, we were able to keep our current structure of having the 7 county council members serve as the Board of Health. The state law change for counties that did change their structure, as was stated earlier, added in additional members of folks who could join the board, including other local governments such as cities, tribal governments, and community members and public health officials. Another slide, this is from the presentation from Jamie from Wasalfo. Washington State was a little bit different than the rest of the country. Across the country, most Board of Health at the local level had already moved in a direction of bringing in folks with public health expertise and with healthcare expertise. So Washington State started to make this move after the law changed. There are a number of counties that did make this change. 24 counties were required to expand by 2022. Some had already started to go down that route, and some made the change after the state law. There were a number that were exempted, and so there were some that decided to keep their current structure, such as Whatcom County. And King County was a county kind of like us where they could have chosen to keep their current structure or their prior structure of having the county council serve as the Board of Health, and they chose to make a change in a new direction. And King County is one of the counties that we interviewed as part of this process. So there's still some variety among counties across the state, though most have moved in this direction. There are only 6 counties left that have their local Board of Health that is made up of their county council and their county council alone or their county commission. Oh, I jumped ahead earlier. This is a slide that looks at across the country. One of the things that we did as part of our process, we looked at some nationwide reports about Board of Health structure and some learnings from the pandemic. This is where we learned about how across the country, most boards of health have at least one member who is a healthcare professional. And they also continue to have elected officials as part of their local Board of Health. So this is a trend that's been going on for some time, and Washington State is starting to catch up with that national trend of having healthcare or public health expertise on the local Board of Health. So what did we do as part of our process? We took a lot of time to study. We looked at some local reports, including a report that the county council um, asked for an after action report regarding the pandemic response. This report looked at county structures, county policies, made some recommendations, a number of great recommendations, some of which have been followed up on. And one of the recommendations from that report, looking back at how things worked in the county during the pandemic, one of the recommendations was to consider a change in the Board of Health structure and going in with this other model of bringing in public health expertise, as well as bringing in cities and tribes into the conversation. Another aspect of that report looked at the role confusion for county council members regarding their dual hats that they wear. That as a county council member, I'm a member of the county council, and I'm also a member of the Board of Health. Though sometimes I find the roles confusing because I'm sitting there with the same 6 other people, so we have the same interpersonal dynamics. We made a change last year where our county council office staff our Board of Health meetings. It used to be the health department that staffed the Board of Health meetings, and we're meeting in council chambers. So in many ways, it does feel like a council meeting, and sometimes it's difficult to remember, okay, I'm sitting here as a Board of Health member and not as a county council member. That issue did come up in the report from consultants. We also looked at other after action reports looking at the pandemic, which also addressed governance structures for Board of Health. There was a state report and there were national reports on this topic as well. And we also had our presentation that I mentioned from Jamie from WASELFO, looking at Board of Health structure across the state. And then we also spent a lot of time studying state law, which governs this. So the state law, for anyone who wants to dive into the details, it's RCW 70.05.035. That's the part of state law that governs structures for boards of health, and in particular for charter counties. There's another section of law for non-charter counties. So it's the charter county law that governs how we do things. So here's an example of what this could potentially look like if we do move in this direction. The state laws says that the elected officials and the non-elected officials must be equal on the board. And as part of those definitions, tribes are not considered under the elected official definition. I'm not sure why they did that, but that's the way that the state legislature set things up. So elected officials are counted as city and county elected officials. So a potential board that would have an equal number, you could potentially have 3 county council members on that board, 1 elected official from the largest city in the county, which would be Bellingham, and that could be mayor or county council. 1 elected official from a smaller city in the county. And one group that we do have in Whatcom County is there's the Small City Caucus, which is made up of originally of the 6 smallest cities in the county. And then during the pandemic, that meeting expanded to include Bellingham as well as the county executive so that they could coordinate policy across the county and across the 7 cities. Though the Small City Caucus still exists and still meets, and oftentimes does select representatives for other county advisory bodies. So this is a common practice that we have in the county of working with the Small City Caucus. To bring in tribes, we could have 1 representative from Lummi Nation and 1 from the Nooksack tribe, and then 3 community members. The state law lists 3 categories for community members. One category is around public health or healthcare professionals. And it's a broad list from healthcare providers of all different shapes and types. And that would be a list that we could draw from for this new Board of Health if we were to move in this direction. The second category is called consumers of public health. And this is a very broad category and could include basically anyone who's a patient. It includes other categories as well and has some priorities for folks who come from disadvantaged communities or experienced inequities in health and healthcare in our community. And then the final category there is community stakeholder. It's another broad category, but there are some specific areas that are called out in the state law, including nonprofit organizations, businesses, and anyone who comes from an entity or as an individual who's regulated by public health. So this might include, let's say, maybe a homeowner who has a septic system. That's someone who would be regulated by the public health system. So this is one potential model that we could go with. This also could be expanded. There are some counties that have quite large boards. King County, I believe, has a 16-member board. Personally, I think that's way too big. I think a range maybe between 8 to 10 or 12 or so might be a little bit more manageable. So this is one potential structure, and there are other possibilities for county council as well. As we did our work, we spoke with other counties, and here are some of the insights we heard from other counties that have moved in this direction away from having their county council or county commissioner serve as the Board of Health, and they alone serving as the Board of Health. One is that elected officials felt like they were able to get quicker information from subject matter experts during their discussions. Because you do have those public health experts on the commission, sorry, on the Board of Health, they then were able to bring in their expertise directly into the conversation and inform the votes and decision-making of the Board of Health. Some counties in their local code, when they moved in this direction regarding the change in their Board of Health, among those categories that I mentioned on the last slide, they chose to have folks from specific areas on the Board of Health. So for example, King County in their local structure specified that they wanted someone with environmental health expertise. So now King County, when they're making decisions around water issues or around sewer and septic issues, they have someone with some of that expertise that's right there at the table to help out. And when you look at how other counties are making their differences between which issues are underneath the jurisdiction of the county council or the county commission, and which issues are underneath the jurisdiction of the Board of Health, water issues and from the health perspective and sewer and septic issues are coming underneath jurisdictions of the Board of Health in other counties. So that's something we may want to consider, is what is unique to Whatcom County that we might want to have at the table at our Board of Health. Diversity is another item that we heard about from other counties. Bringing in people from various lived experience and expertise. Other counties found this to be very helpful compared to our current structure. As you probably know, if you watch county council meetings, our council is not that diverse. Right now, we're 6 men. We have no renters. We're all homeowners, and we're all white. So you know that it would be helpful to have a diversity of expertise and experience on the Board of Health. I would also argue there are other ways to reduce barriers to entry into office, which I know many folks are working on as well, including our Charter Review Commission looking at that this year too. We also heard about a number of other items from other counties that they thought would be helpful in expanding the Board of Health, combining elected and non-elected officials in decision-making, blending the structure of having people who are experts in public health and people who also receive public health on the other end, either via being that category that's called consumers of public health, or really looking at patients in a healthcare system, or people who are regulated by public health. Other folks thought it was good to have both the folks who might be on the regulatory side and those who are regulated in the same room making the decisions. Having tribes in the room was something we heard as a positive feedback from other counties. And there are some examples where there are still elements of, let's say, the Lummi Reservation, where the Public Health Department has some jurisdiction. So for example, within the boundaries of Lummi Nation, there are some water associations that are actually regulated by Whatcom County, via a public health lens. And that regulation occurs via the health department, though there's nothing that states that the health department has to engage with the tribe on those topics, though they do. So this would bring tribes into the room. There was a recent change in state law, actually, just this year, that made a few tweaks to Board of Health structure for counties that have moved in this direction. It's something we're still studying to make sure that the way we're going is potentially in alignment. But for counties that have more than one tribe that have trust lands within the county, you must have all of those tribes on the Board of Health. I was looking at some maps recently, and I believe it is Lemhi Nation and Nooksack Tribe that have trust lands with the county. While going back to time immemorial, the Sauk Seattle tribe, and there are other tribes in eastern Whatcom County around Baker Lake, or if we go even further to the far eastern edge of the county around Ross Lake, there are tribes that from time immemorial did live on, forage, hunt, and fish on those lands, though it's my understanding that currently those tribes do not have trust land within Whatcom County. So for counties that do have more tribes with trust lands, they would now have to add in all of those tribes to their Board of Health. Oh, did the screen go away, or is it still there for you?
I'm still seeing him.
Oh, you're still saying I did something on my end. Okay, now I have it. Here's some other things that we heard from other counties when we reached out and when we looked at which direction we might want to go. One of the things that we did was we put out a community survey. I think there were somewhere between 100 and 200 responses. Joni knows the exact number of responses that it was. So maybe Joni can put that in the chat if you remember, Joni. But a majority of respondents from the community suggested that we move in this new direction, expanding the Board of Health. And the responses that we received from the community were from all across the county and from various levels of expertise. It wasn't all public health or healthcare professionals. There were a lot of different folks who responded to that survey. We also heard from the community when we conducted that survey that there were people that wanted that broader array of expertise on the Board of Health, bringing in healthcare and public health professionals, community perspective, lived experience, tribes, and cities. We also heard from community about wanting more direct communication. So being able to bring in community members into the Board of Health was something that people wanted if we were to go in this direction. Lastly here, one of the things that the Public Health Advisory Board would like for the County Council to do if we move in this direction is to ensure that the duties of the Public Health Advisory Board continue. We do have some things in our county code where the Public Health Advisory Board provides guidance on the county budget and also on the hiring of the director of the health department and on the health officer. As you may know, we're currently hiring, the county is hiring for a new director of health and community services. And there is a role right now for the Public Health Advisory Board in that structure. So this is something that we're studying as well as what might we want to do with the Public Health Advisory Board. Given that the Public Health Advisory Board expanded so that we could maintain our current structure, we might want to contract the Public Health Advisory Board and make sure that their role is well defined compared to the role of the Board of Health. So that's something else that our work group is looking at. We've also looked at the pros and cons of maintaining the current structure. This is a shorter list. There's more to look at as well. But within the current structure, we have electoral accountability. Given that the current Board of Health structure includes all county council members, we're all subject to re-election if we choose to do so, recall if the community doesn't like decisions that we're making. And this is something that I know that a number of people have brought up that they like about our current structure. And I know that there are some concerns that potentially if we move in this direction of having non-elected officials on the board, um, that that accountability might not be in place. This is something that we're looking into in our study of other counties about how they've brought in accountability to their new Board of Health structure. And there are potential ways to remove members of the board if, for example, they're not showing up to meetings. Um, or if the community feels like they're not representing the community well. There may be ways to add that into the process. The other pro of our current structure, as I mentioned on the last slide, is we have an entity that advises the council on matters of health and public health, and that's our Public Health Advisory Board. Most counties that have moved in the direction of having a Board of Health that is made up of a wide variety of individuals do not have a public health advisory board or a community health advisory board. Very few have actually kept that structure as they've moved into this new world of Board of Health governance. Though some other elected officials, when we spoke with other counties, suggested that it might be helpful to continue to have a community advisory board on public health matters. Our current structure, there are some cons to our current structure. We don't have health subject matter expertise involved in the decision making. Now, we do meet jointly. The Board of Health meets jointly with the Public Health Advisory Board, though when the Board of Health makes a vote, it's only the Board of Health, the 7 members of the county council. We don't have health subject matter expertise actually making the decision in voting when it comes down to a vote. We don't have representation of cities or tribes. I think I mentioned earlier, one of the examples of how some land within tribal reservations is regulated by public health, by the county, and there's no representation from the tribe in those processes. Cities also are subject to some public health regulatory mechanisms by the county as well. For the most part, the cities in our county, even including Bellingham, have relegated some roles of public health to the county and to the county's health department. There are relationships between the county's health and community services department and the cities. There's no formal input or governance involved from the cities, given that relationship. I also mentioned earlier this role confusion between Board of Health members versus the county council members. Which hat am I wearing at which time? In my time on council, I've noticed that there are times when we bring a resolution on a matter to the Board of Health as opposed to the county council. And sometimes I think we do that because we want to make a statement that an issue is a public health matter. I think there's some weight in that, though, when I look at how other counties are conducting their business between their Board of Health and their county council. The Board of Health in other counties that have moved in this new direction tend to focus on technical matters. And oftentimes, as I mentioned earlier, technical matters around water, sewer, and septic is where they tend to spend a lot of their time. Also on issues like restaurants and restaurant inspections. Environmental health issues is an area where other boards of health tend to spend some of their time. And I think some of that is because the folks who are in that room are a different makeup than the county council or county commission, and they're there specifically to focus on public health matters and environmental health matters. And I think that helps them to stay in their lane. That's the end of my presentation, and I'll stop there.
I didn't see any questions in the chat, but if there's someone who would like to ask some questions right now, or perhaps maybe Carol, this might be a good opportunity for you to make some comments about this.
Okay, thank you, Councilmember Scanlon, and happy birthday to you. And thank you, Dr. Courtney, for inviting me here and for the League of Women Voters. And I don't want to, I think I'll answer some of those questions if I could share my screen. And I will go over. Okay, so I'm going to talk about why the health board should remain with elected officials. And before I begin, I just want to, explore that and understand that I realize that majority of people here, I'm assuming that you do believe that the health board should be changed. And I understand that. When I got elected in 2018, I was under the same understanding, and I wanted to change the health board also. I was like, why should it be elected officials who aren't health professionals? So I'm right there with you. But I would like you to come on this journey with me of how I got from 2018 and then going through COVID and some incidents that occurred. And I just want to ask you to open your mind just a little bit and see what occurred and see how you would respond. So I'm just going to go over a little background just in case someone here doesn't know. Councilmember Scanlon and Dr. Courtney went over a little of this, but I'm just going to go over what the health board is, what the PHAB is. So what does the health board do? Their main objective is to create and revise policies on public health issues. And then, like we said, we did not need to change our health board makeup because Whatcom County is a home rule charter county. So that means the legislative branch, so the county council members, the 7 members, and then the administration branch, which is the executive. And we're made up of 7 members, they are made up of 7 members of elected body. So 5 of those are from the different districts in the county, and then 2 are at large. And then again, the executive, he at the time manages administration. So the Public Health Advisory Board, the PHAB, we hear that a lot, and currently is 21 members. Like Councilmember Scanlon said, a few members had to be added, but not many. We had a very robust Public Health Advisory Board before COVID, or before the law came into effect, but now it's 21 members and appointed by the County Council, and include 1 member from the Board of Health. And I have this in bold because this comes in later. It's 1 public health officer. And keep that in mind as we go forward. And when I'm talking about the public health officer during 2020, I also want to, full disclosure, it's not any of the members that are public health advisors are officers now. And the membership is very diverse. Members right now, we have doctors, we have professors, we have a lot of, we have epidemiologists, a great, robust, very active PHAB, and we're really lucky to have that. So what they do is, one of the things they do is bring policy forward for the council health board to make decisions. And also, having community forums and hearings, and all of this is all of their charge. It's a big charge for them, all of these things, if you just want to read through them. And they are pretty amazing people and very diverse. And a process is only good as it performs in a crisis. And during COVID, medical was only one part of the crisis, and the other issues were equally important. And in August 2022, I went to the Washington Health Board orientation in Spokane, Washington. I was there with Dr. Greg Thompson, who was our half-time public health officer at the time, and also council member Kaylee Galloway. And when I was there, I went around, because the law had changed and people were changing their health boards. I got to talk to a lot of people about what they saw was great and what the problems they were seeing. And there were issues that came up, and I'll bring those forward later. But I don't have this in quotes from Dr. Thompson, but when I was debating with him about, well, this is what occurred and during COVID, and this is why I don't think the health board should change now. And his answer was something like, I'm just here to save lives. I can't worry about whether a civil war breaks out in the county. And that is the focus of health. The health board is, well, it would be just health, focusing on the health and keeping people alive, which is a great thing. And there are other issues, and I'll talk about those. Some things that are problems with appointed boards. First of all, the definition of democracy is a form of government in which the people elect representatives to make decisions, policies, and laws. And so I want you to think about the committees you've been on. Usually the person with a louder voice or a degree will be listened to the most. From all the communities that I've been a part of, people tend to defer to the person who's more vocal or has more education, and the doctors will be making the decisions. So like the county health officer, keep that in mind again. Appointees lack direct accountability to the public, risk of an echo chamber and over-reliance on individual experts, and other boards like the Planning Commission struggle with attendance. So a question I have for you is, are you happy with the current people appointed in our national government? Do you feel like you had a voice and a choice in choosing? And that's something from PHAB's former chair, Sterling Chick, always said, like, people want a voice and a choice, and how important that is. So why the health board should remain with elected officials? So quicker information access from subject matter experts. So county council and health board members have access to national, state, tribal, city representatives, PHAB members, all county departments on our phones. We can call them, we can text them. I'll say they can text them and have access all the time. Even though I'm a former county council member, I'll give an example. There was an incident last month at Peace Health with Homeland Security, and I was able to text U.S. Representative Larson, and he got back to me within 10 minutes with some information. And all county council members have that access, an instant with health experts and things like that. So the subject matter people are at their fingertips. The robust, diverse PHAB can advise and bring policies forward to the health board, county council to help make decisions. So the county actually has more voices and expertise than other counties, like having a robust PHAB and the health board. So health decisions should reflect diverse community voices from all 5 county districts. We have people elected from the 5 county districts. Elected leaders balance expert advice with constituent needs. And the constituent needs really came into focus during COVID. And the public can hold them accountable through elections. So this is the county council in 2020, and both former council member Red Brown, who was here, and myself wrote a letter to the current council and told them some reasons why we wouldn't want to change the health board because of things that occurred. Both of us went into our roles on the council as, we need to change this. It should not be 7 members who don't have health background. But I want to give you what happened during COVID-19, the worldwide pandemic. So here's one incident that occurred, and I'll just read through these. Obtaining accurate and up-to-date information. The health board, the county council, was consistently denied access to information related to COVID to provide to the public. Communications that did come out of from the health officer contradicted what was being reported for the rest of the world, and it got so bad the county council had to change the county health code to force disclosure of information the county demanded. And some of these remembrances are from former Councilmember Brown, and some are from me. So the county council health board members have communication access again to national, state, city, tribal representatives in every county department and PHAB member. So my question for you would be, would appointed health board members be willing to stand up to a superior county health officer to demand accurate and up-to-date information for the people of Whatcom County? Another incident, preparing for an emergency. Very early in 2020, it was the health board, county council, that was first convinced things would get worse very soon. And the council provided the health officer with about $250,000 to immediately begin buying PPE to prepare for the pandemic. When the pandemic hit in full swing, and for about 4 to 6 weeks later, the health officer was asked to confirm he had bought the PPE, and he was instructed to buy, and he said no, he decided it wasn't necessary. He said he never experienced any problems buying PPE in the past and didn't understand why he would in the future. This fundamental lack of understanding of supply and demand of logistics and global markets resulted our law enforcement, corrections officers, doctors, residential care staff, all without PPE when COVID hit in full force. Other jurisdictions had prepared, and we could have been well ahead of the situation, but we lost that opportunity. So my question for everyone is, would appointed health board members be willing to stand up to a superior county health officer again to demand that PPE be bought? Here's an incident that occurred, housing for those experiencing homelessness. In 2020, the health department and the executive decided to open up Bellingham High School and eventually base camp with a Lighthouse mission to help reduce the spread of COVID. The director of the Lighthouse mission, Hans Urchinger Davis, demanded legal to take out the non-discrimination clause because he does not hire people of other faiths and only people who follow his belief of traditional sex ethic, discriminating against the LGBTQ plus community. So the non-discrimination clause was taken out of the contract. And then a council member, health board member, noticed that the clause was taken out of the contract and demanded it be put back in before voting on funding the project. The non-discrimination clause was put back into the contract before the council health board voted yes to fund the project. And then after, council and the health board again had to change county code to make sure that the non-discrimination clause is in every contract. So my question for you, would the appointed and health board members and the elected go along with the health department and be willing to discriminate in order to keep people safe? So I believe they would have went with the health department, just thinking about saving lives. Council as health board believe that we could house people experiencing homelessness and not discriminate. And COVID vaccines. So before I talk about vaccines, I want to tell you that I was vaccinated. I believe in vaccination and also have my update vaccinations. But county council, along with the health board, did not mandate that our county workers be vaccinated in order to work in county government. The county was employing people from other government bodies that mandated that vaccine. PHAB members supported mandatory vaccines for county employees, but my question for you would be, do you feel that the mandatory COVID vaccines would have been beneficial to the people in our county? And looking backwards now, and as a county council health board member, you take a broader scope of what is best for the community, not just physical health. And one thing I would, during when PHAB was bringing forward, about changing the health board, one of the things I kept asking for is like, well, what are the outcomes? Like to me and to a lot of the county, like what are the outcomes of health that we are seeing in our county? So here's how Whatcom County did out of 39 counties: 11th lowest rate in Washington, or lowest case rate, 10th lowest hospitalization rate, 7th lowest death rate. Whatcom's elected health board structure contributed to strong results. And I think that outcome focus would be good. Let me go back here. If we look at the structures of the health boards all over the state and what they were during the COVID times and the outcomes, I think that would be very beneficial. And I did ask for that while on council, while on the health board. So I want to address some of PHAB's concerns that they brought up and some of those that Councilmember Scanlon brought up. The role confusion with the health board versus the county council member. County council health board members focus on all aspects of residents' life when making decisions, not just like, are we going to keep this person alive, but let's look at everything around it. But just PHAB concern of no representation of tribes or cities. The Lummi Nation and Nooksack Tribe, they're smaller communities than all of Whatcom County. And those that are majority of people that are politically active they can interact at the national and state level because they're a sovereign nation. And so majority of people who we're kind of a lower rung down here. I mean, when trying to get people to run for county council, we're kind of a lower rung because they can people from the nations can serve and be at the national and state level and have those interactions. City mayors and councils have access to health board and county executives and council health board members from the 5 different county districts. Some other concerns PHAB has had: lack of health subject matter experts involved in decision making. Single legislative body holds decision making powers. Again, access to abundant number of health subject matter experts, and the council and health board is elected body representing the people of Whatcom County and all of their needs. Another concern from PHAD was combining elected and non-elected officials on health boards helps reduce political pressure in decision making. For the past 4 years, PHAB has been mainly focused on changing the health board. And if you go back and look at the health board meetings, you'll hear a lot of talk about that. And there's been a lot of time instead of health policy. When appointing PHAB members, lobbying from the health director and PHAB members to get like-minded individuals on PHAB was intense. Even though the public hears that it's a hub and spoke model, there was a lot of lobbying to get people on it that had the same views. Health became extremely politicized during the pandemic, so let's leave politics with the electeds and let the people have a voice and a choice. So crisis management, lessons from COVID. Elected officials ensure access to information during the pandemic, but they had to fight for it. Council addressed broader issues: health, education, discrimination, economics, housing, border crossings to Point Roberts. And COVID had impacts in every aspect of our lives. We all know that. We need to allocate resources, internet connection to kids for schools, and laptops for kids to learn. A crisis was more than just testing and medical. So in closing, I'd like to say that we wait, we study, and we decide. A PHAB focused on health policy and community town halls and outreach can be a great asset to the council and the health board. Major changes should be based on evidence and outcomes, not urgency and political pressure. So expecting council to vote on this before November elections, I feel like that's political. The new health board structures are in their infancy, so let's wait and listen and learn from the other counties first. And then decide thoughtfully. So I really appreciate you listening and hearing my view of what occurred during COVID and allowing you to make your own decision. Thanks.
I want to thank both of you for the excellent presentation and really presenting the issues and the things that we need to consider as we go forward with this, making decisions about the composition of the board and how it's organized. I noticed as you were talking, I noticed there's some questions in the chat. I don't know if everyone has a chance to look at them. Maybe we could answer them out loud. Make it easier for people to who haven't read them to address the questions. The first one I saw, and I do see that you've answered them in the chat, but I want to make sure everybody gets to hear this. The first one was from Michelle Kopcha. Seems like, and I'm probably mispronouncing your name. I apologize for that. It seems like the proposed change in composition is heavy on elected officials and light on experts. She wanted to know about the rationale behind the proposed mix, and because the board is deals with very complex subject matters requiring reliance on science evidence-based expertise. Could one or both of you comment on that? Just summarize maybe what you put in the chat.
Are you saying about the makeup of the health board, what it would look like?
Yeah, I think the question referred mostly to the mix of expertise on the board.
Yeah, maybe
The elected officials versus experts.
I know there's prescribed in the law, there were prescribed people who would be on the health board, but maybe Councilmember Scanlon knows more.
Yeah, and I put a link to that part of state law for anyone who wants to look at it in the chat there. part of state law, it's RCW 70.05.035. And so the state law, if we were to make this change, it designates the membership of the group. There are options for counties within that. And I do agree with the comment there that it does bring in other folks, other types of folks, and there's really only the one specific category for someone with public health or with healthcare expertise. One thing I will say in looking at other counties and how they've done things, in other counties, when tribes have been brought into the Board of Health, oftentimes it's someone with public health or healthcare expertise from the tribe who's been brought in. Sometimes it's a physician with the tribal health department or an official with the tribe's health department or health clinic that's been brought in, not always a council member from the tribe that's been brought in. So that's another way that other counties have brought in public health or healthcare expertise into their newly constituted boards of health.
I saw another question, some other questions from Maya Morales. First, she wanted to know if there are some changes to the health board that could be made via the charter amendments and what they might be if there are. And John, she also said you mentioned ways to, I can't read, it's blocked out, to remove members. And how would that, what are some of the ways that could be done?
On the first question, I did have a few other members of the Charter Review Commission ask about this, and Maya is a commissioner on the Charter Review Commission. So specifically, I would say no. There's nothing that's needed in the charter in order to move in this direction or to keep the current model. The state law allows a county council to determine the best route forward, and a majority of the county council to determine the best route forward. So I would say no authority is needed in the charter in order to either keep the current model or move in another direction. Second, on removal. So this is something I started looking into more recently, given the feedback, and I appreciate the feedback from former council members, from Carol and from Rudd on this. I've heard from others on this as well. Current Councilmember Ben Ellenboss was a dissenting vote when we voted on this at the Board of Health, and this is one of his concerns as well. And actually, Councilmember Ellenboss has joined in our current work group that's diving into more detail and looking at code. And he's been very helpful, even though he's was a dissenting voice. So this is why I've been looking more into removal processes. So one example of a removal process is if the county wanted to remove the health officer, there's a pretty high bar to do so. So if the county executive wanted to remove the health officer of the county, they must have a hearing in front of the county council before any decisions are made. And there are some other examples of similar processes where if for various reasons, if someone is not fulfilling the duties of their office, there would be a process for them to come in front of the county council before being removed from the office, and they would be removed by a vote. So for example, if someone is not meeting the attendance requirements, so we're looking at attendance requirements for the Board of Health. One example might be, if you miss 3 meetings in a row, you could be subject to removal. We have had other county advisory boards where we've had some attendance issues, and oftentimes what we'll do is we'll contact the individual via a variety of formats: email, phone call, a letter. I think we've even had folks knock on their door just to see what's up and to see if they still want to be a member of the group. If they don't respond, we have taken action in my time on council to remove folks from advisory boards if they're not regularly attending meetings, meeting those attendance requirements. The other action we've taken is some of our county advisory boards have residency requirements where you have to reside within Whatcom County. So if someone moves and they no longer meet that residency requirement, we've also taken action to remove them from boards. So we do have some processes in place. And again, to allow someone that time to have a hearing in front of council before being removed.
Some of these issues come up with other positions on advisory boards and staff and such for the county. And usually they're done in private. The result is announced, but the details are not publicly available. Would that be the case in this type of situation?
I think it's something to consider, whether it should be in public or private. I mean, I wouldn't want to have someone have to reveal any private details, for example, around, health, right? I wouldn't want that to be out there. So, something like that could potentially be shared in private. But other items, may be better for a public forum. And I think given the concerns around accountability, I think you would want to have some of those items out in public. I think the other thing, to think about as well with some of this is, and I think some of the comments in the chat have gotten to this, is to think about how is it that these spaces are inclusive? And I think sometimes some of our county advisory boards have not always been as inclusive and welcoming to many folks. And one of the things we've looked into is things like with a body of that's got some power, it has some regulatory power, and you are going to potentially be asking people to volunteer their time. Should we be doing things like providing any type of stipend or reimbursement? I know this is something that the Charter Review Commission has debated and discussed this year. For example, if we have a member of the Board of Health, who lives in Maple Falls, should they be reimbursed for their mileage to come into Board of Health meetings if they're in the county courthouse? There's things like that we're exploring as well through our work group process that may also get at some of these inclusion issues.
And then I think I saw some questions from Leah. One was, is the advisory board really equivalent to a seat on the Board of Health in the eyes of tribes? Do they feel? Do you have any feelings about, any idea of how they might feel about that?
I think that's a good question for tribes.
Yeah,
I can't
okay.
speak for them. And this is one of the things that I'm doing right now with Councilmember Ellen Boss is we're reaching out to city elected officials and to tribal council members to hear from them, because I don't want to move in this direction if they're not interested. If cities and tribes aren't interested, this doesn't work. So we also want to hear from them about what might work for them. And I do see the other item in the chat here. Yes. The other entity I've reached out to is the American Indian Health Commission of Washington. Under state law, they are the entity that conducts the outreach process and then makes the nomination to county council to consider for the appointment. So yes, I think learning from the experience from that entity. I've asked other counties about this as well, about how the process has worked for them. And I know there are some counties that have struggled to fill those seats. I don't know the answer to that, but I do wonder if, as Carol mentioned, sovereignty issues, come into play here. And I also wonder, how you're making these bodies truly inclusive so that someone who's coming from a sovereign government feels like it's worth their time to sit with the county and make decisions.
I see one more question in here about public hospitals, but before I ask that, are there any additional questions from anyone here related to the health board? Yeah, I'm not seeing any, so so yes, I will put that question to you because I know. Oh, Barbara, I see you
Thank
have
you.
your hand up.
I had one and I sent it to Maya rather than to everybody, but I'm not totally clear on all of the areas that the Public Health Advisory Board deals with. And of those areas, which are the most contentious and therefore needing different kinds of advice? Is there a way to figure that out?
I'm
John?
wondering if we do have some members of the Public Health Advisory Board here. I am a member representing council. But, for example, one item that's been contentious, I'd say, this past year is budget. As part of state law and in county code, the Public Health Advisory Board is intended to advise the county's health department on budget. I would say that last year, when the county council approved the biennial budget, or our budget for 2 years, the executive branch of county government may have met the letter of the law, but not the spirit. There was a presentation in front of the Public Health Advisory Board on the proposed budget, but it was not a timely presentation. And it was not really done at a time where the Public Health Advisory Board could really weigh in and advise both the department, the county executive, and the county council on the budget. And this year, the Public Health Advisory Board has been continually asking for budget updates and has not received those budget updates from the health department. So that has been a challenge in our current process and structure. I would say it's the same for county council as well. The county has had some financial management issues, moved to a new financial system, and we have not been receiving enough regular reporting on county revenues and expenditures. And up until recently, the county executive was not able to meet a part of our charter where at the end of each quarter, the county executive is supposed to send a financial report to the county council within 6 weeks of the end of a quarter. And they had not met that for some time. They did meet it for the first quarter of this year. And I would say that was probably because myself and a few other council members are really starting to put some pressure on that issue. And they did deliver that report on time, but it was the first time in a few years since they have been able to deliver those reports on time.
I have maybe one final wrap-up question about this. Where is this question going next? What's the next action or meeting, or what's happening?
Yeah, so we have a work group that's continuing to do some work on this. And Joni is part of that group. I'm part of that group. Councilmember Ellenboss and Councilmember Donovan are part of that group. And right now we're looking at county code. What would this potentially look like to present some options to county council to see if this is a direction or which direction the council would want to go in. I do have a goal of trying to get if we do move in this direction, to have a new Board of Health sat this fall. So that would be a year. We started this process in October of last year. So this could potentially lead up to fall of this year. And what I would like to do is, I think Carol mentioned the Board of Health training that the state runs. There's a Board of Health training every fall, and it usually occurs in October. And if we do move in this direction, I would love to be able to have new members of the Board of Health attending that training in person this fall. So this could potentially see an ordinance in front of county council to decide on this summer so that we could have time to recruit. And I would argue that, this is something that this work group has been studying since October of last year. So I would argue that we have taken our time. I have spoken with Carol about this. I've spoken with Rudd about this and their critiques. I am taking that critique into consideration and trying to put forward the best process here. I'm not trying to make this political in any way. I know that concern has been out there. Yes, this is an election year in the county council. Some of our county council members who are up for re-election, some don't have opposition. and I would argue some don't have competitive races. And so I am not trying to do this in any type of political pressure way. County has a lot of work to do. This year is a year where we're doing our planning process. We're going through our comprehensive plan, which is a timely process and procedure. This fall, we're going to do what we call our mid-biennium review of the budget. We're in the middle of our 2-year budget cycle. We take a look at where things are at. There is a lot of work for the council to do. So I think that 1 year of process is a pretty good process. Yes, I think we could have more public discussion. So I really appreciate League of Women Voters for holding this discussion today. And I think we can do more to bring in opinions on this and to shape this and potentially say, you know what, we want to stick with our current process. We don't want to change. That option is still on the table. I don't think we should debate this forever. There's a lot of work to be done in the county.
I'm assuming most of these meetings that you will be having are public meetings. They're at least on Zoom. They can be attended on Zoom, and there's lists on the county website of how to link into those meetings.
Yes, so the council meetings, we will be discussing this in council meetings. Public Health Advisory Board has been discussing this topic as well. And the Board of Health, our next Board of Health meeting isn't until the end of July. So I think you'll likely see more of this actually in council meetings rather than in Board of Health meetings, because it would be county council that has the authority to make the change, because it would be if we do make a change, it would be a county code change, which is under the authority of the county council.
I want to thank both you, Carol and John, for coming today and presenting this information to us. It's been recorded, so people who couldn't come this morning will be able to watch it out on the website. Typically, it's 2 or 3 days before it actually gets posted out on the website, but it will be there to be seen. And I want to thank both of you very much. I think you clarified some of the issues, some of the things that need to be thought about, and it has been very helpful. I appreciate this. John, there was a question in here about public hospital districts, and I realize we're getting kind of late here, and you have other places that you go to, and I assume you probably do too, Carol, things you do. I don't know whether you have time to answer that question today or not. I'm suspecting that the answers are very involved and may actually be better answered at another meeting if you would be willing to come back and talk about it. But
I would be happy to do that. And for Carol's question, I put my contact info in the chat. I'd be happy to connect in that item. There are a number of folks who've expressed interest in this issue. And some folks are coming together, including I'm hearing a lot of interest right now from some of the unions at Peace Health. There's a lot of interest from the nurses, from SEIU, from UAPD, the newer union that's also representing physicians at the hospital. So there's a lot of interest in this issue. I think that there's a lot of work that would need to be done. And actually, in order to, if we did move in this direction, it would have to be a citizen initiative or a resident initiative. The county council on this issue does not have the authority to take action or put anything on the ballot. So it would have to be an initiative. So we'll have to get a coalition together to go out and gather signatures and put something on the ballot. I think probably this is something that could potentially be on the ballot maybe in 2026, but probably more likely 2027. I think some more work is needed to pull a coalition together and do the work to get it out there.
just for information for people who may not have been part of the league or involved in healthcare, I was a year, maybe 2 years ago, the league put together a presentation about public hospital districts, and I know you were there, John. You were part of that meeting when we gave that presentation, and that that a video of that should still be out on the state website if anyone wanted to look at that. And yes, you will get another email, John, requesting that there's another, you schedule another time when you can come back and talk to us about public hospital districts, if you would be willing to do that. We
Great.
would love to hear that.
I'd be happy to.
Okay, thank you very much. Um, if we have just a little bit of time left.
Thank you,
I will go
everyone.
Yeah, thank you very much, both of you. I will go into just some kind of catch up and business things, such and that sort of thing. Are there any announcement, anyone here doing anything, have anything going on that they want everybody to know about? Okay, I don't see any hands, so scream out if there's anything that you want to announce or say, or okay, I'm not seeing anything. If you think of something later on, to let me know. One of the issues that important issues that have come up is a federal issue regarding the federal budget and the cuts to Medicare um, that are pretty substantial and are likely to have a lot of effects. As a league, nationally as a league, um, we want to address those cuts. We don't feel that it is beneficial. Uh, Local league also supports, or maybe a better way to describe it is opposes those cuts. And we would like to organize a letter writing campaign. Uh, Write your legislator about that. There will soon be uh, points, bullet points that you could put into your letter. The most effective way to write letters is certainly to address the issues, and if possible, to include some personal effect it's something will have an effect that it will have on you or your family or your neighbor. That's kind of the glue that sticks the statistical information that's kind of dull and boring in someone's mind when they read this. Uh, they'll remember the statistics if they remember so and so. This is going to happen to them if this cut happens. Um, we're looking kind of at it's kind of a two-pronged effect because our legislatures generally do not support these cuts. Um, so I think a thank you letter to them for their opposition to the cuts is appropriate, very appropriate. Uh, but we also need to address, we need to talk to legislators who are in different areas of the country who do support the cuts and make them realize what the results might be to the people in their own counties and state. So we are suggesting, and we'll provide kind of a template that you could send to friends in other states, family who might live in other states, and ask them if they will contact their legislators and about the cuts and oppose the cuts. So that will be happening soon. If anyone else has any ideas, suggestions, comments, would love to hear them. And I see one hand up. Carrie, your hand is up. What do you have to say? What can you add
Hi.
to this?
It's a different topic, and if it's not appropriate, I apologize. But when you had mentioned if we had anything to share, I'm the Silver Beach Neighborhood Association president, and I'm organizing a session and update that's open to the public that'll have our legislators will be there. It's on June 7th. I'll send out additional information, but it's a great time to come ask questions and have a little bit less formal town hall where you can ask the questions you want to hear about from our representatives.
Which legislatures, which representatives are these?
So I'm in the 40th, but I also collaborate with, I'm a associate member of the 42nd district. So it'll be representatives from both the 40th. So Alex Rammel, and at least one from, I'm sorry, one member from the 40th and one from the 42nd. And I've contacted all of them. They're looking at their schedules, and I'll know for sure who will be there. And we'll share that information.
That would be wonderful. Yes, if you send me that information, I will make sure that it goes out to the healthcare group, so that we know about that. Yes, I would love to ask some
Good.
questions of the legislature.
I would imagine you would, yeah. So that'll be open to everyone.
Yeah.
All right, thank you.
Okay. I am also very soon. I will send an email out, kind of with information about what legislation, healthcare related legislation, that was supported or opposed by the league. How our legislators voted on that. So that will be coming out within a couple of days. It's going to take a little bit to get that all together. And in fact, there's still a couple more. The governor still has a couple more days to sign legislation. So that information would also be included there. But when you meet with at this meeting on the 7th and other meetings during the summer, that information will be available to you if you want to thank or question any of the legislators about their vote on any of these pieces of legislation related to healthcare. So, any other questions, comments, ideas? And I'm not seeing any hands or anyone yelling, screaming. Or oh, Nancy. Yes. You're on mute, Nancy.
Sorry, I just put it in the chat that not everyone on this call may know your contact information or even your name. Could you put that out in the
Oh.
chat, please?
Yeah, I'll do that. I'll do that right now.
Thank you.
I'm going to have it sent directly to me because I can't remember my official email with the league.
I don't know how to raise my hand. This is Mickey. I put a message in directly to John, but I thought, well, I might as well mention it to everyone here. But one thing that I'd like to see is that diabetes prevention becomes a public health priority, you know, for many reasons. But one is to be ensured, or at least we hope, to have a healthy workforce for the future. And also I think that naming diabetes prevention as a public health priority would do a lot to kind of reduce disparities, because many of the people of, you know, with racial and ethnic groups are they are more prone to become either pre-diabetic or have diabetes. So anyway, I just wanted that on the record.
Thank
I'm
you,
glad
Mickey.
you said that, Vicki. Yes, that's just something I should have remembered to announce. I forgot about that. Yeah. You're my auxiliary memory out here, all you people, and I appreciate that. So, anyone else who wants to raise their hand, call out, whatever, and say something. And I am not seeing anything. So with that, I want to thank all of you for coming today. You are the strength of our committee. It's the people who come and learn about what's going on in the county. Very important, and I appreciate all of you. And I will see you next month in person, probably on June 16th, but more information will be coming about that. And thank you very much, John. I appreciate this. Thank you.
Thank you, Mary Lynn, and I appreciate the work that you all do on health and healthcare in our community. We've got a lot of work to do. See you next time.
Yeah. Bye, everyone.